Welcome to another episode of the Curious Jord podcast. Today my conversation features a chit-chat with a paramedic. We chose to keep his identity and location a secret as to not reveal any sensitive information. This is also the first episode I'm releasing in the COVID-19 era, which means that I did the interview by phone, so the audio quality is podcast COVID quality. I think it turned out alright in the end. This episode is essentially in 3 parts. The guest was at work during our conversations, and given his line of work, he had to answer the call of duty several times. I think it makes for some interesting audio overall. I hope you enjoy the episode.
Yeah, just anything that would like give away like, oh fuck, that was whatever so and so that got killed or something. Like,
no, totally agree. Like anything that would clearly identify your identity or your location or whatever. Like I'll let it out. I'll be sensitive about it, you know.
Yeah, no worries, man. It's all good.
So who did get killed? Like, tell me all about it.
Oh god.
Okay, what was the last one? You said it was a transfer. What's that mean?
Yeah, so it's just like moving from one hospital to another. So like right now we're in like a rural area, smaller hospital. So if the patient needs anything specific, done like interventions or something, then they would just refer them to one of the larger centers, with like say like neurosurgery or heart surgery or whatever. So yeah, you pretty much just drive them from one place to another and monitor them on the way, and that's about it.
Is that fairly common?
Where we are, like in the rural areas, with the smaller hospitals, yeah, they can only handle so much. Like a basic medicine patient that doesn't really need, like they just need like general monitoring and no real specific interventions. So anything beyond that, then they ship them out to the larger centers pretty quick.
You do any helicopter rides?
No, we've had them land on scene. If we're outside of the city center, and there's like a big accident or something, or if we're like in a really remote location, then sometimes they'll land on scene with us, and we'll just transfer the patient over to them. But yeah, no, we're not allowed to actually ride in the helicopters. But watching them land's pretty cool, though.
That's a bummer.
Yeah.
I got a lot of questions I want to ask you. And I was like really trying to think like, what would be good questions, you know?
Well, you can ask them all and edit them out later. It's fine.
Yeah. And then like right at the end of just thinking about it, I was like, oh, is it fucking cool to like just turn on the sirens and drive?
Yeah, it is. That kind of like, that's really cool at the start of my career, like the first like 2 years. But then it
was cool for 2 years.
Yeah.
that's pretty cool.
Yeah. No, it is cool though. Like it's nice to, especially like, 2 a.m. when the city's empty or whatever, and you can just kind of cruise with no traffic. Traffic's a big pain in the butt. Like it's definitely one of the least favorite parts of this job. Like people don't see you, people don't pull over. Like you can blare your siren all you want, but people are listening to their podcasts or whatever with their headphones on, and they don't hear you or see you. So as awesome as sirens are, like if you're in traffic, you're pretty well stuck in traffic with everyone else, honestly. But yeah, if there's no traffic, it's a lot of fun. We're only allowed to go 30 kilometers over the speed limit, though. Anything beyond that, there's like a computer, like there's a computer in our truck, and like our management can see everything you do and how fast you turn and how if you're wearing your seatbelt or not. So
Is that the same for the cops? Do you know? Like 30 over?
No, I don't think they have. I don't quote me on that, but I don't think I don't think so. I think that's a service specific thing. That's not even like the the Highway Traffic Act. That's like that's our ambulance services policy.
Like
Um,
you guys in your little
yeah,
area.
so my employer tells me I can't go over 30. Um, the like I'm not going to get pulled over by the police or something, but um, yeah, it's just employer specific. I'm pretty sure the police can go as fast as they want, though.
Yeah, but don't you feel like okay, like yeah, you're only allowed to go 30 over or whatever, but like don't of all people who could go 31. I mean, you could go
Well, yeah,
31.
yeah, for
Imagine you're
sure.
in an ambulance fucking speeding going 150 through a school zone and a cop pulls you over being like, "What are you doing?"
Yeah, you might get some looks if you're going 150 through a school zone, though. I don't know. But it can be actually fairly embarrassing sometimes if you're driving on like the major highway and you can only go 130 and you're getting passed by BMWs and stuff, but that's just the way it is, I guess.
Imagine. You got like someone in the back say like have you ever well, I don't know. I'm just throwing this out there. Imagine like you had someone in the back, critical condition, and you're like, "Oh, we're only allowed to go 30 over." So, we'd like to
Yeah,
get you there
I
quicker.
mean, yeah, no, I mean, you're gonna get them a little quicker maybe, but at the end of the day, it's just an email you have to answer to the upper brass. So it's been done before, I guess.
We didn't want to let them go, but policies.
Yeah, no, there is like a certain time and place where you'd probably break that rule, but
Okay. Have you ever had to push that 31, that 32? What are you talking about?
I've never answered an email, but
Oh, good
I don't
on you.
know. Yeah, that doesn't mean it doesn't happen, I guess.
Here's one thing I was always wondering, and this may not be true. Seems totally might not be true. Is there a disproportionate number of paramedics who are bald?
Bald. I don't think so. I don't know. I'm going to say no, but I don't know the real statistics. Is that something you've noticed?
Yeah.
What? Yeah, I don't know, man. I don't think so. I'll
Okay,
I'll
okay.
try and get some numbers back to you. Can
Yeah,
I would no.
if you could find a survey, that'd be good.
Okay. Look into that.
Maybe results of the survey, not just the survey itself.
I can just go through the list of employees and tell you how many are bald.
Okay.
I'd probably say 5%. 10%,
Okay.
including male. That's male and female though, so
All right. Now we're talking
that's going to be edited out, right?
business. No. I'm mailing your information to the desk,
Oh.
Okay, I got a pile of questions. I'm just, oh, my cheeks are tender from smiling already.
hopefully they improve. That last one was questionable at best.
Okay. Did you go to driving school?
No.
There was no ambulance driving school?
No, not really. We went to this they called it skid school,
Yeah. That's
but
not
it's not as cool as it
nothing.
sounds.
Oh, okay.
It's not like you go to like a racetrack and no, they did a little driver's training thing for the service, but not what you're thinking. Not like on like a closed course with,
Mm, I wasn't
spraying
thinking
fire
that.
hoses and stuff. Yeah. No, you do. Like honestly, you kind of just learn as you go. That's the one thing that I find you're wildly unprepared for when you start is driving with lights and sirens because it's actually illegal to to practice that. Like you can't just practice driving with lights and sirens in traffic.
Yeah.
You actually have to like be going to an emergency. So you definitely start like when you, for the service I work for anyways, you start, you have to put in, I think 250 hours it was of regular driving before you can even drive with lights and sirens or with a patient in the back or whatever. So you're just kind of observing, I guess, and just learn from your coworkers. But yeah, it's definitely something you just have to kind of learn on the fly.
So what was it like that first time you get to flick that little light switch, you know?
Oh, it's fairly terrifying the first few times because, um, yeah, just like I was saying before, like the traffic around you isn't really like no one really just pulls over and stops. It's never that easy. They're no one's watching. You got to go through red lights and people are blowing through the red or I guess they have a green, but they don't see you and they're just going to run through that light. So you really have to be cautious. And first few times you drive with lights and sirens, your adrenaline's pumping and you're not really, as focused as you should be on your surroundings. And
when you're driving, like I guess it depends on certain situation, but like do you got a person in the back like working on the patient, or like are they right next to you, or is it case by case? You know what I mean? Like you must be cautious of the turns if you got a partner in back like trying to
yeah,
put a
for
needle
sure.
into a vein or something.
Yeah, you definitely have to watch. Like it's usually just you and your partner. So if you're returning from a scene to the hospital, then they're in the back and they're doing stuff back there. So you're kind of watching in the rearview mirror to see, do they have a needle out or are they sitting down and whatever. But yeah, you definitely want to get there. Your priority is more so just getting there safely than quickly in most situations. But definitely something you have to be aware of for sure. Don't slam on the brakes. I've been tossed a few times, luckily without a needle in my hand or something, but you definitely get tossed around back there if you're standing up or doing something with the patient. But
Do you like flip a coin with your partner for the night? Who gets to drive?
no, we just alternate generally. So usually like the lower seniority person will start off attending and then the higher seniority person will drive. Um, in my situation, like I'm advanced care. So if there's a patient that needs something that I can do, then I'm obviously in the back, but generally you just alternate.
Hmm. How long have you been doing it for now?
7.5 years now.
Holy fuck.
Yeah, I graduated 8 years ago now, 2012. And then, yeah, I've been working for 7.5. So, and
That's
then
wild.
three years as advanced care.
I'm sorry, dance care?
Dance care, yeah. No, advanced care.
Oh, advance. I thought you said dance.
No.
Like
Dance care. It's not a thing.
it is a thing in my world. You want to know about advanced care? Listen, I got dance care, baby.
Oh man.
Okay. Back to the questions. Let me get a little more specific up on you. A little more specific than dance care. Why did I've always wondered this? I probably asked you before. Why paramedic? Why?
Yeah, I was thinking.
Why paramedic, and also why paramedic?
Yeah, I don't know. I was thinking about that answer, and I don't actually have a great one for you. It just kind of like I think when I was in public school, like a paramedic came and did like a little like, oh, here's the ambulance. Come look at this cool stuff. Um, and that kind of like initially sparked my interest, and then I initially wanted to be an architect, but I didn't go through the correct streams of math in high school.
Turns
And
out
then
watching George Costanza doesn't get you there.
yeah, well, it's probably a good thing, honestly. I can't imagine being stuck in an office or something all the time. This seemed pretty cool. I always kind of wanted to like, you know, give some sort of contribution to society. So it seemed like a good way to do that, and seemed like it would be fun and exciting. But yeah, it worked out. So I'm glad I did it. But no real specific reason why.
Mm. Has anyone ever called you an ambulance driver?
All the time. Yeah. It's highly offensive. But
Yeah, I could understand that.
yeah, I don't know. No, it's not that bad. It's just I don't know. I don't think a lot of the public doesn't really the whole concept of paramedics is actually pretty new, honestly. Like um just our scope of practice and everything, even 30 years ago wasn't as close to what it was or is now. Because back then that's basically what we did was just drive the ambulance, right? But in the last 20, 30 years, our scope of practice has really increased, and there's kind of been a big push. We used to be called emergency medical services. And then a few years ago, all the services changed their names to paramedic services just to kind of get that paramedic word out there and try and promote that whole thing.
When I was looking into like just Googling shit, YouTubing stuff, I didn't know if the information I was getting was American or Canadian. And then when I saw the whole thing of like people calling you like ambulance drivers, I don't know if that was a notion that ever even dawned on me. Like I just assumed that the person driving the ambulance would know something about medicine.
Yeah, no, I don't. I think a lot of people are surprised at like what our scope of practice is. Um, like I said, I think that's changing now. Yeah, I don't know. Some people are. I think maybe just the older generation or what, but
I was thinking like I'd love to be an ambulance driver.
I
I was watching the videos like that looks sick. I don't want to know anything about what the fuck is going on over there. Maybe that should be a little side profession or something like.
Just be an ambulance driver. Well, it is. I think in a lot of places in the States, it is. You know, like you got your EMT and your paramedic. So like the EMT is kind of like, you know, they can run some of the equipment and whatever.
So what's the difference between EMT and EMS? Because I've been seeing. Oh no, I'm getting a call.
Oh no.
I feel like I'm at the North Pole.
Yeah, that sucks.
You gotta go.
Yeah, I think so. Okay. I'll answer that question though. What did you say? EMT?
No, what was the call?
Oh, I think we have to cover another area. I don't know. I didn't hear. I think it's a standby, so we just have to go and cover another area of the county just because another truck has gone out.
Okay, well, you go when you got to go. The question was, what's an EMS versus an EMT?
Oh, so EMS stands for Emergency Medical Services. Mm-hmm. So that was like I said, like the old term for paramedic service. Okay. EMT is Emergency Medical Technician. So that would be like primarily in the States. They're like the ambulance driver, but they'd probably be offended if you called them that. But they basically, so down there they have an EMT and a paramedic. So the EMT kind of runs a few things and drives, and the paramedic does most of the medication and stuff.
Okay, so now paramedic is kind of like the updated term.
Yeah. Was that just code 8? Yeah. To where? All right. Yeah, I gotta go.
All right, man.
What are you what's your next few days look like?
Well, it's the weekend, so who the hell knows? You know, I might be calling one of you guys.
Oh my god. Okay. I assume, I don't know, you're probably going to bed, are you?
Yeah, I gotta go to bed.
All right. Well,
we'll reconvene. We'll do it again.
All right, man.
All right, dude. Safe paramedicing.
Sounds good. Right. Thanks.
Bye.
See ya. Oh, I got some stats on for that.
Oh, no way. Nice.
Yeah.
Hit me with the stats.
So it's not any more proportion than usual, I think. Well, it was tough to find um, like general population stats, but basically male pattern baldness in general is like up to 50%. Um, and I calculated like the majority baldness for paramedics, and it was only 25%. So of male, that was full timers, so like above the age of like probably 25.
This is the staff where you work?
Yeah, where I work.
Okay.
So, and then I decided that this is like one of those frequency bias, like like a Bader-Meinhof phenomena where a bald paramedic, so you see bald paramedics all over the place.
Mm.
So I think that's why you think that all the paramedics are bald, because it's like when you buy a gray Honda Civic and then see gray Honda Civics all over the place.
What did you say that was called? Ader Meinhof?
Bader-Meinhof phenomena.
Bader Meinhof. I was actually thinking about that today because that phenomena, because one of the dudes I work with drives a certain Jeep, and then every time I see that kind of Jeep, I'm like, oh, that's him. But now I just notice those Jeeps everywhere. Like, oh, there's a lot of those.
Yeah, yeah. See, it's the same thing with bald paramedics. I'm sure you just see them everywhere.
I wonder if in movies they're often bald.
I don't think so.
Okay. Okay. Other stuff we covered. Skid school. I asked you why you became a paramedic and the difference between EMS and EMT. So let's start checking off the questions I got here.
You'll probably hear another page go off in 7 minutes. It's just a test page, probably. So
Okay.
just ignore that, hopefully.
No sweat. Ignore the call. What's the formal training to become paramedic?
So it's right now, anyways, it's a 2-year college certificate program. Some colleges are different. Like some will do it like in a full year, like 3 semesters. And then now some are doing degree programs.
Mm.
But I think in general, 2 years, uh, 2 college years, anyways, gets you like your basic. It's called like a AMCA certificate, and that's just gets you to the primary care paramedic level. Generally, you need some sort of prerequisite for that, like whether it's like I just did like a 1-year college pre-health program. Some people go in with like kinesiology degrees or whatever, but I think anymore, very few schools will accept you straight out of high school to the paramedic program. So you need some sort of post-secondary education generally. And then for me, I went back to school after 4 years of working and did like a full year, so 3 semester program to do the advanced care portion. So in total, I have, I guess, 4.5 years of schooling. But yeah, that can vary from 2 to 1 to, yeah. In general, though, it's a 2-year program.
Yeah, when you said 2 years right off the bat, I was thinking like, I feel like you were in school longer than that. But yeah, what was it, pre-health, pre-med, you said?
Yeah, pre-health, which is honestly just like upgraded grade 12 science, math stuff. Mm. But I think the colleges just want you to have some sort of post-secondary experience. It makes a big difference too, just for the job, because you could potentially be coming out of school at 19 or 20 or whatever. So that's not necessarily ideal no, for this career. So it's not a bad idea to get that post-secondary first anyways. Mm. But it's definitely it's a heavy 2-year program. And I don't know what the 1 year program that some colleges do. I don't know how they would do it. It would be um, pretty busy for sure, but it's a lot of content in one program. But
Yeah. You ever just like show up on a scene and throw up?
me personally,
Yeah.
no. No. I've heard of students doing that. I think you probably figure out pretty quickly if you have a weak stomach or not, and if you did, then you probably wouldn't go into this career. But
What do you mean by students showing up? Like, I thought you just said like there's no apprentice program, is there?
so the last full semester, you do ride outs throughout the school year. Actually, like where I went, even the first semester, we were doing ride alongs.
Yeah.
So you're on the ambulance for some portion of time, and then your last full semester is all practical. So you'd have like a preceptor that you'd shadow. So like one paramedic that you ride out with full time for 3 or 4 months. And yeah, so you do get a lot of on the truck experience too. So that's kind of when you really figure out if you like this career or not. So you get a good idea in school what it's about. But
You ever see anyone throw up?
no.
Okay.
No, I have not.
You ever show up and someone's like a patient shit their pants?
Oh yeah,
Pretty common, eh?
that's pretty common. Yeah, that's not uncommon for sure. Um, yeah, you get into some pretty disgusting situations and poop everywhere, and yeah, sometimes it gets on you, and you just gotta keep going.
Yikes. That's fucking gross, man.
I mean, we have like there's you have protective equipment and stuff and gowns, and if it's really bad, then there's like the full body Tyvek suit things you can put on, and um, but yeah, it's definitely not the most fun part of this job,
Okay.
but it certainly is, I would say, fairly common for sure. But
What's the protocol? Say, I mean, I guess you wouldn't know this with any person, but say you're treating somebody and they're all bloody, and like you don't know if they have any kind of something you could contract from their blood.
yeah,
What's do you judge that on a by situation? I mean, how could you judge it?
I mean, you pretty much treat everyone like they have Hep C.
Okay.
So you're always wearing gloves and stuff, and um, like just regular safety glasses too, if it's a situation where you think, you might get sprayed in the eye or something. But yeah, you're just very cautious of that. And I mean, Hep C is probably your biggest worry, because that's probably the easiest bloodborne illness to catch anyways.
Yeah. You'd rather have Pepsi than Pepsi.
Yes, that's true.
Although Pepsi is gross.
Yeah, Hep C is actually pretty common too, like fairly common with like someone that does IV drugs, kind of that.
Okay. Are you
that demographic? But
yeah.
You pretty much just kind of assume that, and not even, I mean, I'm not saying that you only assume that with IV drug users, but you kind of just have to assume everyone has it and treat them accordingly.
Makes sense.
Yeah.
How often do you show up on a scene and the reason why you're called there is just completely stupid? Like, why did they call 911?
Yeah, more often than you'd think, I think. Yeah, I don't know what the stats would be on that, but fairly common. And it's difficult too, because you can't really, like, I mean, we're not going to show up and you can't really scold someone for calling us in most situations, anyways, because you kind of, you don't know what that person's emergency is, and maybe this is more of a, anxiety driven thing, and to them it is a severe emergency, and they're, having a horrible day or whatever.
Yeah.
But yeah, there's certainly some where you just kind of shake your head afterwards, and you get the odd like toe pain call, or and
pain.
what, some of the worst ones are even just like, someone's got the flu, like,
And there, it's probably anxiety. Like they think it's more than it is.
yeah, yeah, I don't know. I mean, people handle things differently, and different coping mechanisms and whatnot. And some people just literally can't handle, having a fever and throwing up at home by themselves, or, if they live alone or whatever, then um, obviously
Yeah, it's
they
probably
feel they
worse
just
if you're by
can't
yourself.
manage. Yeah, for sure.
Yeah.
But yeah, just because I wouldn't call an ambulance for something doesn't mean someone else wouldn't.
Mm-hmm.
So, but yeah, it's fairly common, and like, just with all the, COVID stuff going on and whatever, at the beginning of that, we noticed a huge difference in call volume, just because we weren't getting that, because a lot of people were afraid to call us, because obviously we're in contact with sick people and they don't want to go to the hospital or whatever. So that stuff kind of disappeared for a while, which was nice, but it's starting to creep back. People are back to their normal habits and less cautious and whatnot. So, but it was good for a bit there. Our call volume had gone down fairly significantly, actually.
Have you been in contact with someone who's had COVID?
Um, like confirmed swab positive, I think maybe one or two,
So you got like
maybe.
your protocol and your dress must have changed a bit when all that came on.
Yeah, for sure. Yeah, we have like, we were doing like droplet precautions, which is like a mask, face shield, gloves, and a gown. And then if we're doing any procedures that they're like aerosol generating procedures, they're called. So if we're like delivering a lot of oxygen or ventilating someone or whatnot, then we kind of go the next level up in protection and have full respirators and all that stuff. So, but basically we have like a list of screening questions that we ask. And if they've been in contact with someone in the last 14 days that's suspected or has had it, or if they're awaiting test results, or if they fail a list of symptoms that would be common for COVID, like a fever or shortness of breath, cough,
Yeah.
then we just take those precautions anyways.
Makes sense. Let's get into some juicy stuff here, okay?
All right.
I want to hear some real gruesome, morbid shit right now.
Okay.
I was trying to throw that in as you were sipping. try and get that
The coffee spit. Okay.
Yeah, like what's I mean, everyone's you probably see so much stuff, it's hard to come up with a story on the spot, but like is there one, is there, it doesn't necessarily have to be gruesome or morbid, but like a story that sticks out is like, wow, these humans are fucking weird.
Oh, yeah, it's tough because you can't really like, um, I mean, I can't really elaborate too much on some stuff like that.
Sure you can. You don't
Um,
need names or places.
yeah.
You ever see anyone go through a wood chipper?
No, I've been pretty lucky that way. And you'd like, I think the human body's more resilient than one would think. Especially now, like, it's not like the old days where, if you wreck a car, like, odds are one of you is getting decapitated. Like, that just doesn't happen anymore. The cars are built so safely, that like that stuff's just not as common as it used to be. Obviously, like motorcycle accidents and stuff are, you're kind of just left on your own out there. But I've been pretty lucky that way. I haven't really had any crazy motorcycle collisions or.
What's that clicking noise?
Oh, sorry. Can you hear that?
Yeah.
Oh boy. Okay, I'll stop.
No worries. No worries.
Yeah,
So
you know what? I don't even know if I have like a specific one that you're not that you're looking for. I don't think it's as, gnarly as you expect it to be, if that makes sense.
that's highly disappointing.
I think a lot of people have that one call in their career where, like, and I've certainly had some bad, like car collisions and stuff where, people are hurt pretty bad and, bones sticking out or whatever. I think there's a certain point too where like, an accident scene is just that extreme where it stops looking real, if that makes sense. Like it just like the human element kind of disappears from it, and it's just like, bones and meat, and it doesn't even it doesn't even register as, that's a person. So yeah, I don't know, maybe that's just my messed up interpretation of it, but I think you kind of hit that point sometimes where it's just like, oh wow, like that doesn't even look like anything. So
do you think that's in part because you have a job to do, or is that perhaps because you've become like a bit desensitized to it all?
probably a bit of both. Yeah, probably a bit of both, but I don't know. I think it's even just, I think a lot of people would have that regardless of their experience or whatever, just because, you see stuff in the movies and whatever, and you've seen that before, and it doesn't look any different in the movies than it does in front of you. So it's just kind of like surreal that it wouldn't, yeah. If it's not like a living, breathing person in front of you, then you don't really register it as that, I guess.
Mm. Is it, I mean, this might be a dumb question, and I'm probably going to ask a lot, especially that bald one. Do you like, how much of your job, like, do you carry home? Is it something that lingers with you, or it depends on the day?
Yeah, it depends on the day. It's not like certainly, you know, it wouldn't be like a once a week thing where I have like a bad call or whatever. And I think it depends too on your situation and like how you are attached to that call emotionally. Like for me, I have two young kids, so any calls where there's like young kids involved, obviously that's gonna probably hit me a little harder than it would someone else maybe. I mean, kids are always super tough. And I can imagine too if, someone just lost their dad and then they go to like 60-year-old male who dropped out of a heart attack or something, that's going to be pretty tough for them. Yeah, so I think the calls that affect people for sure are ones that they can relate to emotionally, like just through their own experiences or what's going on at home or whatever. So yeah, and that being said too, it might not even be what you would think it would be that would bug you. It might just be, the person might be absolutely fine, but just for whatever reason it resonates with you a certain way or whatever, brings out some of your old experiences or
Yeah.
whatnot. But yeah, personally for me, it's mostly just, young kids and stuff.
Yeah.
After a while, you like to the regular, like whatever elderly person that's passed away, like it's just kind of a part of life, I guess. And you're a part of that situation and play your role and try and, comfort the family and do the best you can. And that kind of becomes routine. But yeah, there's nothing too routine about a kid dying or something. So those are the tough ones. But
Yeah. Do you ever lose anyone?
lose any patients?
Yeah. Like that you're trying to
Y-
resuscitate.
Yeah, for sure. Like calls where someone's pulseless, or the term we use is VSA, so vital signs absent. Um, so that, I mean, it varies. Some people could have those calls once a week. Um, for me, I don't know, it's hit or miss, I guess. Comes in kind of waves, but um, maybe a couple times a month or something. So as advanced care too, we're sent in the city I work in. Like they'll send the closest truck, and then if there's an advanced care truck, which is probably more than half of the trucks, but depends on the day. Some days you might be one of two trucks in the city out of 20 that get sent to those calls. So I definitely get them more frequently than most trucks. We're sent to all the cardiac arrest or DSA calls. And now I forgot the actual question was, but
Oh, I was just asking you, like, how many people died?
oh yeah, no, it's a fairly common call. Like not super common, obviously. Like I said, maybe once a month, or depending on just what's going on. But
Practice
no,
call.
that was just the test page there, so ignore that one. Yeah, it depends on the month, I guess, or whatever. But it's pretty common. So
Is that fucked up? Like,
no, like I said, like it's just kind of like, obviously death is natural, so you're a part of that person's experience. Like some are tougher than others, like young people or kids or whatever. Obviously anyone under the age of like 70 is premature, but no, you just kind of do your job and be there for the family. And if it bothers you, then talk to someone about it. And
do they offer like therapy for you guys?
yeah, so the last few years for sure, like the last probably 5 years, it's been like a big push for mental health awareness and stuff. So we have a peer support team. So just like our coworkers are trained in, I don't even know what they would call it, I guess just peer support. But so if they know that you've had a tough call, and not necessarily, like every time someone dies, you're not going to get a call from the peer support team, but a particularly bad call or whatever, generally like young people or whatnot, then you'll get a call from a peer support member, and they'll kind of reach out and say like, hey, like, I get a call, just let me know if you need anything. They talk you through it if you need. Um, and then we do have services through our employer that we can get in contact with a therapist, or as well, like post-traumatic stress is kind of recognized now as an actual, mental ailment. So if you needed prolonged like therapy or whatever, then that's going to be covered in your work insurance. So there's certainly a lot of resources available. Whereas, I mean, I wasn't working 20 years ago, but it certainly was a different culture then. It kind of changed a lot from, just suck it up, it's part of your job, like,
Yeah.
to, let me know if you need anything and talk to me, and conversations.
That's cool.
Try and keep it going. So yeah.
It's nice to know that's there.
Yeah, for sure. Yeah, we've got a pretty good setup here. And like I said, just the whole like culture in general has changed a lot. So
no longer an ambulance driver.
Yeah, exactly.
Stitch him up. Do a little lighter of a question this time.
It's all good.
Yeah. Yeah, it's all good, buddy.
Jesus.
How do you I'm just wondering what like the station is like, because I know sometimes you do have quite a bit of downtime. So like, how do you guys fill downtime, and like what What does the station look like? Do you have your own food in the fridge? Do you have a microwave?
Yeah, like it's you're here for 12 hours, so you're cooking all your meals here and stuff. Like there's no like oven or anything, but um yeah, microwave or skillet or something, like toaster oven. Um then you got just like basically recliner chairs and a TV and computer room, and that's about it. There's not really much to it. We're not like the fire hall and stuff has like beds and stuff, so we don't do 24-hour shifts. So on our 12-hour shifts, we're not tucked into bed or whatever. Um, but we have chairs we can rest in or whatnot.
Ping pong table.
Yeah, you know what? The base I work at right now has a ping pong table. That's the only one in the service that does.
Good to hear.
Doesn't get used very often, but it's there. I think someone scooped it up off the side of the road one day.
Oh, nice.
Yeah. But yeah, like you can, it depends on where you are and whatever, but you can bring things to occupy your time if you want. But for the most part, we're steady enough that we can, obviously you're in the like the city, then you don't really so there's some days you barely have time to, eat your lunch and stuff. But yeah, if you're in the rural areas, then you might have more time to kill. But for the most part, majority of the bases, you're just kind of getting your break and eating your food, and you're out again. So
yeah. What do you think, or what do you wish people knew about your job that like most people don't know?
I think the culture's kind of changed a lot as well. Like just with people knowing our scope of practice and, what we can do and the medications we can give. And, I think a lot of people were surprised because the year just before I started, like primary care paramedics could start IVs. So that was only, 10 years ago or less that was fairly common. That used to be just an advanced care skill. So a lot of people wouldn't see that very often. But I think now though, like people kind of understand our scope, but you do get some people that don't really understand exactly what we do. And like we were saying before, like, they just assume we drove an ambulance and that's about it, which is what the job used to be. But yeah, other than that though, like I think people have a fairly good understanding, especially now. Like there's that like night watch show and stuff. People are all into that and gives you a pretty good idea of what our job's about. So
Did you tell me about that last time? Night Watch?
I don't think so. Maybe. I don't think so.
Is it on Netflix?
It's I think it's A&E maybe. Yeah.
Oh, like TV.
A&E. Yeah, like cable TV. Yeah.
Uh-oh.
All right, I can probably call you in 20 minutes.
All right, cool.
Is that cool?
Yeah, man. Drive safe.
All right, I'll call you in.
Okay, bye. Testing. 1, 2, testing.
Hey.
Okay. So what was that call you just put on?
Oh, that's just another standby. In the county, there's a lot of standbys, like just driving, covering other areas of the county. So, one truck moves. Generally, there's like one truck in each little pocket or village or whatever. So when one of those trucks move, they kind of shift around the coverage so that there's adequate ambulance coverage throughout the county. So pretty common out here. But
so you guys just like leave the station and go like park up at a spot?
Yeah, we just either like a spot in between two bases, or we just go directly to another base, or just kind of cover for however long that truck's gone, and then head back to our own base.
So the other people came back, and then you're Are you back at the station now?
No, so we're at our coverage spot, and then we'll move back once the crew's done their call, drop the
Okay.
person at the hospital, and then head back to their base, and then we'll clear out of here.
Well, who's in your spot now?
There was 2 trucks at our base, so there's another truck there, but they kind of prioritize it by population sometimes. So, if you're at a pretty unpopulated area, a lot of times you'll be moving around to the more populated spots just to better cover, I guess, like more likely to get a call somewhere else than at your spot. So,
okay, I see. You ever go into somebody's house and they're like a hoarder?
yeah, that's probably more common than you'd think. The hoarding situations, but actually, we're pretty good kind of middle ground for that, where we have a company that we can call and like a service for hoarders. So if we go into a spot like that and like it's an unsafe living condition, obviously we kind of have to tell them like, look, you're probably not really safe in your home, and we can get you in contact with someone that comes in and assesses, and kind of like someone like on the show or whatever, right? Where they come in and consult with the person and clear out their house and have a team come in and do their cleanup. But
so
for sure,
you're obligated to like report that they're living in a.
I mean, you need consent from them, so it's our job to kind of push them towards that. But we can't just give them their number, and force them into anything. If it's a rental situation, I guess. I mean, that's not really our area. That would either be like fire, police, whether it's like a fire hazard or whatever, a legal issue. Then that situation, maybe that would be mandatory for them to set them up with that. But for our part anyways, it's more of like this service is available. I believe it'd be covered by the government or whatever, for them to come in and assess the situation and whatever. We kind of just tell them like, it's just a consult, and we're not forcing you to do anything, but
yeah,
this is available.
Okay. I when I worked for that junk removal company.
Oh, right. Yeah.
I used to see hoarders all the time, and it was smelly.
Yeah. Yeah, it can be. It depends what they're hoarding. Yeah. I've seen bottles of pee before, like just bottles and bottles of pee. Someone was talking about a call they did where the guy was hoarding his own feces, like just in random containers and briefcases throughout the house, and that was just his thing. So it can be quite disgusting.
Yeah, unsavory.
No, yeah, for sure.
Has your job given you like a sense of gratitude?
As to my own living situation, you mean, or just like?
Yeah, do you see like certain situations people are in? You're like, Jesus, that's fucked up. Like I'm fine. Like I don't have any complaints.
Oh yeah, for sure. Yeah, I mean, I had a pretty good upbringing and whatever, so I'm pretty lucky that way. And yeah, you see how other people live. I think a lot of people are fairly, blinded or whatever. Like they don't really see that side. And like you said, you've been into people's houses with hoarding and whatever, probably squalor living conditions and stuff. And yeah, it's not the nicest thing. So it makes you appreciate having a roof over your head and,
Yeah. Have you
secure job?
Yeah. Oh yeah, for sure. Have you treated someone where they were like violent and they didn't want to receive the help you were trying to provide?
Yeah, we get in those situations, fairly often. Usually they have a pretty good idea like when the dispatcher takes the call. So when someone calls in, generally they'll have a pretty good idea whether the person's going to be violent or not. And then at that point, they would send police with us. So we wouldn't go into a situation knowingly that, this person's swinging or has a weapon or whatever. We're not just going to walk in without police presence. But yeah, you certainly get situations where generally it's, someone under the influence of drugs or alcohol or whatever, and they become violent. But more often than not, we have police there to help us. We do have, I carry like a sedative that if, this person needs medical attention and is being combative, either if they have like a head injury or something, and you can't really assess them or get them on your stretcher to the hospital safely, then we can sedate them to kind of help that process along. But I mean, you can't just go and sedate anyone that's just being violent. But if that person needs to be seen and it's more of a medical emergency or a mental health issue or something like that, where they need to go to the emergency room, then instead of the police arresting them and restraining them and whatnot, sedation medication is actually safer for them to get them there. So,
like in the news and stuff, we see a lot of stories coming out about like Oxycontin or fentanyl or like those kind of extreme opiates. Are you seeing sort of an uptick in that kind of thing, like overdoses?
Yeah, there has been for sure. Where I am, there's actually still a fair bit of meth, which honestly isn't really that fun to deal with. It's obviously more of like an upper. So the people are usually, those are the people you see on the news that are running naked in the street and potentially violent and whatnot. But we certainly do see the opiate overdoses. Now there's a lot of like just people in the community have access to the Narcan kits that reverse the opiate effects. So we see those being utilized a lot. So a lot of times when we're called, either like a security guard nearby will have a Narcan kit on them, or the police carry them, or even just, if someone's a drug user, they are offered them at the different like health unit offices and stuff. They can go just pick one up. So they carry them as well, just in case, their buddy takes too much or whatever. So they'll give them a lot. So that's definitely helped. Because basically like
what's in those that reverses the overdose?
So it's called like a competitive agonist. So it basically competes for the opiate receptors. Okay. So it's basically when you give that drug saturates all of that person's opiate receptors that would normally make them, drowsy, stop breathing, pass out, that stuff. So it knocks all of the, whether it's morphine or heroin or whatever, off of their cells and replaces it with this Narcan, which has zero effect. So it just blocks all the receptors off, and the person just goes right back to as if they had nothing in their system. I mean, obviously, like it depends how much you give. You kind of give a slow dose and just slowly wake them up and kind of give them a more gradual wake up. But a lot of times, like the community kits and stuff just kind of blast like a high dose, and they just pop right up, and usually.
So say in like a situation where an overdose was occurring, and say that Narcan.
Yep. Narcan, yep.
Narcan that was administered, and then you guys show up on the scene. Is the person in duress usually like, are they stable? Or are they just like sort of in a passed out state, or like what's going on with them?
You saying after it's been given? Sorry.
Yeah. Like.
Yeah, so they can be quite confused, groggy. They can sometimes wake up and be violent and not really. Obviously, like they were just passed out, and then all of a sudden they're surrounded by a bunch of guys that look like cops or or usually we have police there as well. So sometimes they're not super pumped about that.
Mm-hmm.
But yeah, it's sometimes, it's fine and they wake up and they're relatively normal. It's usually, obviously, they're a little groggy and stuff, but yeah, it really varies. But you kind of have to be ready for them to come up swinging or something if they're, going to be caught off guard by all the people surrounding them and they have no idea what just happened.
In that situation, would you end up taking them to the hospital, or like do you just leave them there after?
We certainly try. We can't force anyone to go to the hospital, and a lot of times they'll refuse to go. The issue with that is that generally the Narcan doesn't last as long as whatever they took, like just a regular opiate. So a lot of times there's just the risk that they'll pass out again. So, I mean, we're certainly trying to get them to the hospital, but people can make their own decisions if they're of sound mind and awake and whatever. So if they don't want to go, then we can't force them, but it's certainly, we do everything in our power to get them there. Sometimes in that situation too, it's better to, get them on our bed and kind of breathe for them a little bit until we're in the truck, and then we can give the drug and kind of get on our way to the hospital. And then, at least we can maybe get them to the emergency room doors before they decide they're going to go home. But yeah, certainly ideal if they are willing to be assessed by a doctor and hang out at the hospital for a bit until their other drug wears off.
Do you get a lot of like reoccurring offenders,
I'm sure there are. I mean, there's a lot of trucks in the city, so I don't know if I've, I don't know. I probably had the same person a couple times. But
you don't ever get a situation where you go back and you're like, oh, this guy again.
Yeah, you probably do. Yeah. Not necessarily for drug overdoses, but for other things as well.
His big toe is hurting again.
Yeah, for sure. Yeah, there's some people that, they just are likely to call or have people call for them. Like, they look like they're in distress walking down the street.
Yeah.
Whatever. But yeah, you certainly have your frequent flyers that you run into once a month or so.
I wanted to ask you too earlier when we were talking about training and education and stuff. Do you guys get like a course on bedside manner, so to speak, or like how to deal with like family members, or like how to talk or coach people?
Not really. Yeah, no, there's not really like a specific course on that. We have like a crisis intervention course in school, but that's more of like a complex mental health case, or complex cases like a death notification or something like that. But just a general communication course, not really.
The death notification being like telling someone that their loved one has passed away, or?
Yeah, so there's so where we are, we can like do a pronouncement of death on scene. So say someone dies in their home, we go and we do a resuscitation of some form. And then based on what we're seeing and how the patient's responding, generally we'll call a physician and kind of let them know what's going on. Give them a rundown of what we've done and what the patient's heart is doing. And then they kind of decide, okay, yeah, maybe you should bring him in and we'll continue resuscitating, or just stop resuscitation and pronounce the patient there. So then at that point, it's kind of our job to talk to the family and let them know that the person's deceased. And yeah, so that can certainly be a tough situation. But
so what do you say?
the key is, I guess, just be very direct with them, and use like the word death, uh, like you would say, like, you know, just be straight frank with them. Like, your husband is dead. These are the things we've done. His heart didn't respond. We've spoken to a physician. Um, and at this point, there's really nothing else that can be done. Uh, so we've stopped resuscitation, and you just kind of reiterate that they're dead and make sure that they understand that. Uh, if you use words like passed away or gone or whatever, then it's not really as um, like effective that way. Like, it seems harsh, but uh, they it's just better for the grieving process for them to kind of understand right away, uh, instead of, you know, I don't know if it's like whether they think that there might still be a chance that they're alive, or they're not really processing it appropriately. Uh, but yeah, it's definitely something that, like, the first time you do it is terrifying, and this is someone's husband or father or whatever. Like, it's a big deal. So uh, yeah, you get better with time and take some practice, but it's definitely one of the harder things we do, I think.
What was it like the first time you did it?
Uh, I don't, I don't know. That would be quite a while ago. I'm sure I was nervous, and I probably figured my voice was super shaky, and uh, yeah, I don't really remember exactly, but I know it took a while before you were confident in your notification, and because the key too is to be, you know, confident and look like you know what you're talking about, and whatever, be direct. And um, so yeah, first few times is definitely tough. You kind of just have to do it and get better as time goes on. And like, you got your partner too, so um, they can kind of be there to help you, or police are there to help too if you know the person has any other questions or whatnot. But
Yeah, I'm just thinking of like giving that notification. There must be, and I'm sure this changes over time. You want to be direct as protocol dictates, so your language is clear and they firmly understand what's happening. But there also must be a human aspect of it, like in the background of your mind, like wanting to console the person.
yeah, for sure. And like, you can console the person. You first and foremost have to, you know, give them the news and make sure they understand. And then, um, yeah, if they need a hug or whatever, then you're there to do that. But for the most part, your job is kind of to be the person that can answer their questions at that time and go from there.
Yeah.
And a lot of times we won't really stick around that often. So we'll kind of do the pronouncement, kind of get our paperwork in order. And then police will generally stay until like a coroner comes or a funeral service comes. So a lot of times they're there to kind of sit with them and do that. And then there's like victim services and stuff to help. So if they're needed, they can call them in. But I'm just going to jump on the air here. We're just clear, so I can talk for a minute. Yeah, you're good.
Okay. Are you
We'll just do it, and as long as it sounds fine, it's not too noisy or whatever. This truck's kind of noisy.
not too bad? What are you doing right now?
We're just driving back.
Okay. I wanted to ask you with the say if someone's dead on the scene and like you pronounce them dead, what happens to the body after that?
So yeah, like, it generally, like I said, we don't really stick around that often after um, our pronouncement. We'll kind of make sure that they don't really want, like, they don't have any other questions. Um, at that point, we kind of direct them to police for anything that they need. And then police will either call the coroner if they think the coroner should respond, or they might just call the funeral home directly, and then the coroner can go to the funeral home after and kind of do their thing. But yeah, generally I don't know. We like I said, we don't really stick around that often, but I wouldn't think it's more than a couple hours before either the coroner comes or the funeral home comes to remove the body. But
I always thought if they were dead, like they got took to the hospital anyways.
no, the hospital's only involved if we transport them to the hospital. I don't know about like autopsies and stuff, whether like in that situation, the coroner would probably come out and kind of do their thing. And then afterwards, I would assume that they would take them to the hospital to do like a full autopsy if that's what they think needs to happen. But otherwise, they generally just go directly to the funeral home for like the embalmment or whatever.
I hope you enjoyed that episode. If the ending seemed a little abrupt, it's because the audio quality started to diminish further, so I just cut it off. Plus, we both just started rambling about things that were unrelated to the topic. Either way, I enjoyed recording this one and getting a closer perspective on what it's like to be a paramedic. A little side note, when the guest was talking about Narcan, the overdose kit, he says that it is a competitive agonist drug. He later stated to me that this was incorrect and that it is actually an antagonist. Just a little correction there. He wanted to make sure his facts were straight. Yeah, once again, so I hope you enjoyed that. If you want to check out more podcasts, you can download wherever you downloaded this one, or you can go to the website, curiousjord.com. All right, stay safe out there.